Hello, everyone. Hello, everyone. It is my distinct pleasure to be introducing for you today the 2018 Jarvik-Russell Award winner. It was also my distinct pleasure to work with Dr. Andrea Villanti for several years at the Schroeder Institute, the American Legacy Foundation, and this has been, I think, a pleasure for all of us to be able to talk about this at this conference and really celebrate in it. It's remarkable. If you talk to any of the people that were in the Schroeder Institute over those years or in Donna Vallone's Research and Evaluation Department, there's nobody that has a higher level of respect, I think, and admiration. And with Andrea, it's not just her science, it's not just the fact that she's always the most prepared, et cetera. It's just what a amazingly good and kind and happy person she is. I was thinking, I think the best way to put it is I think Andrea is really a happy leader, and we're lucky to have her. So I'm not going to take any more of her time. But please, we're lucky to have her. Please help me welcome Dr. Andrea Villanti, 2018 Jarvik-Russell Award winner.
Wow, well, this is quite an honor. Thank you all so much for being here today. I'm thrilled to talk today about developing research to inform policy, which is a passion of mine. These are my disclosures. I'm an associate professor at the University of Vermont. I have no other conflicts to disclose. So I bet that most of you thought you were going to come and hear about menthol today. And even though we've seen tremendous declines in smoking prevalence and we've seen increases in the prevalence of menthol cigarette use over time, that's not what I'm going to talk about today. I'm going to focus on a case study and on a project that I worked on over 5 years at the Truth Initiative, the Young Adult Cohort Study. And I think this is an incredible case study in how we can conduct and pivot to do tobacco policy research to be rapid and responsive and relevant, the 3 R's per David Abrams. So for those of you who aren't familiar with this study, this is a study that we launched in the summer of 2011. Of approximately 4,000 young adults aged 18 to 34 at baseline. And we conducted 10 waves of data collection over 5 years, approximately 6 months apart. This was an online panel run by GFK that did address-based sampling so that we could have weighted estimates to provide nationally representative estimates in our study. We oversampled African American and Hispanic young adults at baseline, and we also refreshed the sample at every wave, so we had approximately 4,000 young adults at each wave of data collection. We had an incredible team working on this project. We had a core team that included Jessica Rath, Donna Vallone, and myself, 2 incredible analysts, Amanda Johnson and Val Williams, and then a number of our internal collaborators who provided survey items or provided feedback on the surveys, wrote papers out of the data. So we had an incredible core team of people working on this project. So to give you a context of when we started this, so summer of 2011, and we had started talking about it late in 2010. And this was pretty close after the Tobacco Control Act was passed and we had FDA regulation of tobacco products. But there were a number of items on the to-do list for FDA, including looking at menthol, examining potential ban on menthol, reports on dissolvable products, prohibiting light, low, mild pack descriptors, and also examining how to implement large graphic warning labels. So over these 10 waves, we had some core items that we looked at, which included items related to the Truth brand, but also tobacco product use, ever past 30-day, and ever in past 30-day, and then frequency of use as well. For a number of products, e-cigarettes, and a number of tobacco products, including hookah, smokeless, and snus, right from the outset in 2011. We also had measures on social influences on tobacco use because we knew those were important for adolescents, and we wanted to explore that in the young adult sample. And we also collected data from the start on menthol tobacco use, menthol cigarette use, and menthol use of other tobacco products because that was an area of our interest. In subsequent waves, we added items on flavored tobacco use. We had items on anticipated responses to graphic warning labels, and we had items on tobacco harm perceptions across many of these waves of data collection. So the first paper we published out of the study was from our baseline data, looking at the patterns of tobacco use and dual use in US young adults, and describing this as really the missing link between youth prevention and adult cessation. And this is hard to read, but I just wanted to show that we looked at, across a number of products on the rows, we looked at every use, we looked at the product that was first used, we looked at mean age of initiation of using that product, and then among everyday and someday users, past 30-day use of each product, and among those users, how many days, frequency of use. So this was tremendously rich data that we really hadn't seen across multiple products previously. And we also looked at dual use. And this was early as we were thinking of dual use in the field, looking at cigarette only versus cigarettes plus other products versus other product use only compared to no use, and looking at correlates of those patterns. One of the really important parts of the Tobacco Control Act was this new public health standard. So looking at how FDA was going to regulate products to protect public health. And one of the explicit interests of FDA was in vulnerable populations. So our early work really focused on some of those groups, including sexual minorities, race, ethnicity differences, differences in nativity and SES. So we had papers come out on the prevalence, higher prevalence of tobacco use among those who were sexual minorities, and then more recently on the relationship between tobacco harm perceptions and sexual minority groups. We collaborated with a group of demographers at UT Austin who were experts in data collection on race, ethnicity, and nativity, as well as socioeconomic status. And we were able to look and parse out differences by those who were foreign-born Hispanics versus US-born Hispanics, showing that nativity mattered, and that was something we should be collecting more information on as we were doing survey research in our large population. So we saw here that foreign-born Hispanics had significantly lower odds of cigarette and other tobacco product use compared to non-Hispanic whites. We also know that young adults are an important group and a group that is in transition between adolescence and adulthood, and our typical measures of SES, like education and income, don't really capture what's going on in that group because they are in flux. So we validated a measure of subjective financial situation in this group, and then we were able to correlate it with cigarette use prospectively. So getting back to the more policy relevant, the topic areas, we had data on menthol and flavored cigarette use across 3 waves. We had information on graphic health warning labels. We started to pull in geographic identifiers into the data set, and that was around the time that PATH was getting started, and we were able to collaborate as part of the PATH contract. We proposed a number of studies in the young adult cohort to try to inform some of the item development in PATH. So this led to a number of papers looking at the prevalence and longitudinal patterns of tobacco use in young adults, the relationship between retail outlet density and young adult tobacco initiation, the potential response of young adults to graphic health warning labels, and also a lot of work on menthol. So we had patterns of longitudinal transitions in menthol use showing that people typically started and stayed with a product over time. And then also looking at correlates of current menthol use and current flavored other tobacco product use. And it was some of the work that we did on flavored tobacco product use that, again, led to the work that we collaborated on as part of the PATH project in the Wave 1 data, looking at showing a gradient in tobacco product use among youth and young adults compared to older adults, and really highlighting this as a priority issue to be considered by FDA for regulation. So at this time, we were also seeing dramatic changes in e-cigarette advertising expenditures. You can see here over time from 2010 up to 2014, just a tremendous rise in advertising expenditures. And one of our colleagues, Ray Nyora, said to us, this longitudinal study, and I paraphrase, this longitudinal study is great, these observational data are really great, but we could do a lot more and be more informative and have stronger causal inference if we ran experiments in this observational study. So that was the first time in Wave 4 that we ran an experiment on e-cigarette advertising, where we exposed half of the sample, we randomly assigned half of the sample to be exposed to 4 ads, and then the other group got no ads. And what we measured, we had a number of pre-exposure measures, including sociodemographics and exposure to tobacco industry marketing, to peer cigarette smoking, susceptibility, e-cigarette awareness. Then after each ad, they were asked about their likability of the ad, whether they'd seen the ad before, whether they'd ever tried the product. And then after exposure, susceptibility, curiosity and susceptibility to use the product, as well as tobacco product use. So in our groups, we had approximately 4,000 people who were randomly assigned to one of the 2 groups, so 2,000 in each group. And when we looked only at the exposed group, we looked at ad awareness and likability in this group of 2,000 people. And you can see here the 4 ads. There were some differences in ad likability between 2 of the ads, but generally they're all sort of in the same range. But what we saw was that when we looked at the relationship between likability and our outcome measures of curiosity and susceptibility, for a 1-point increase in ad likability, there was more than a 2-fold increase in the odds of being curious to try an e-cigarette, of intending to use an e-cigarette soon, or being willing to try an e-cigarette if a best friend offered. And that was among people who had never used an e-cigarette before. So we saw that likability of the ad contributed to their curiosity and susceptibility to using the product. And this was controlling for a number of covariates, including age, gender, race, ethnicity, education, income to poverty ratio, their other experiences with tobacco marketing, past 30-day cigarette use, their awareness of e-cigarettes, and peer smoking. In the main results of the trial, we actually were able to look, in addition to our Wave 4 measures, at the subsequent behavior 6 months later. So we were able to look at how exposure at Wave 4 impacted behavior at Wave 5. And we looked specifically at cigarette trial, e-cigarette trial, and frequency and intensity of cigarette use. So again, this was our full sample of 4,000, where we got down to 2,000 exposed and 2,000 unexposed, and at follow-up we had 3,000, about 1,500 in each group. And in our crude and adjusted models, in our crude models, we saw a relationship between exposure to the ads and curiosity about the product, and that they would try the product if offered by a friend. We also, among e-cigarette never users at baseline, saw an increased odds of trying the product at 6-month follow-up, and among never users of both e-cigarettes and cigarettes at baseline, again, increased odds of trying the product. After we adjusted for some imbalance in covariates across the 2 groups, the 2 findings that remained significant were the relationship between e-cigarette exposure, ad exposure, and curiosity to try the product, as well as e-cigarette exposure and trial of e-cigarettes among never users of e-cigarettes and cigarettes at baseline in a small sample in a small number of young adults at follow-up. So that was almost threefold increase in the odds. So at the time, at this time, we were also seeing some more information come out from FDA, including the proposed deeming rule, which we were so excited to see. And at that time, there was a lot of information in that deeming rule related to what products should be covered and how should they be covered by FDA. So there were requests for information on a number of products, which led to publication of a number of studies on tobacco product brand preferences, across products, cigarettes, cigars, and e-cigarettes, on correlates of cigar use by type and flavor. We looked at correlates of hookah use and predictors of hookah trial, showing that those with lower harm perceptions of hookah were more likely to try a hookah 6 months later. The proposed deeming rule also included information on a proposed warning label. And this is not the text from the proposed warning, but the idea was that there would be some sort of a label on all tobacco products that would relate to the addictiveness of nicotine. So this led to a subsequent experiment that we ran with collaborators, Chris Del Nevo, Darren Mays, Andrew Strasser, and Olivia Wachowski, looking at how participants would respond to either warning labels on the product, and we tested both the short warning of nicotine is addictive plus the very long warning that was existing on the Mark 10 ad. It was, I think, 73 words long about all of the potential harms of using the product. And then we also tested a claim that we were seeing, and specifically Chris brought to our attention, that we were seeing these words on packaging for e-cigarettes: no ash, no tar, no smoke. And we thought that these were sort of modified risk claims that were being propagated on packaging, and we thought it'd be interesting to look at how these things interplay to influence perceptions of the product. So that's all the teaser I'm going to give you, because this is under review. In addition, this was a time when we saw the youth data come out from NYTS and this tremendous jump in e-cigarette prevalence between 2013 and 2014. And so we were also alerted to the fact that there was, in addition to an increase in use, there was also a change in the survey items between those two waves. So this led to a measurement experiment that we ran in the Wave 9 data, looking at how question type, so whether you had a check all that apply list, or a breakout question, standalone questions for each product, how that influenced prevalence, along with the order in which things were presented, and whether you added product images, how all of those different permutations of presenting these items to capture prevalence would affect the prevalence estimates that you got from the survey. So this was, again, a randomized design. I think there were 6 conditions where people got some combination of the type of question, the order of the question, and whether they got images or not. And this, again, is under review. We had posters on those things last year, though, so you could go back. And then the most recent experiment that we ran was from Jennifer Pearson's work on American Spirit, looking at the impact of pack descriptors, and this goes back to the light, low, mild ban on descriptors that was implemented in 2010, and now we have additive-free, natural, and organic, U.S. grown, that we're still trying to figure out how to deal with. So this is a study most recently that we ran exposing people to ads with or packages with different claims, descriptors on them, and how that affects their perceptions of harm of the product. And that is a project that's underway now, and Jenny will be presenting tomorrow if you want to hear more about that. So we were even more excited in 2016 when the final deeming rule came out. And in that rule, again, we saw the nicotine warning label. So this is the actual text from the deeming rule. This product contains nicotine. Nicotine is an addictive chemical. This is now going to be on all packages, all products. And so one of the important things for us to understand is, how do people understand nicotine? And how is this going to benefit public health, or are there other things we need to do, sort of mid-course corrections, to make sure that having a warning like this on the product is a public health benefit? So we added a battery of items. In addition to our tobacco harm perception items, we added a number of items on actual nicotine perceptions and beliefs about nicotine, beliefs about NRT, beliefs about e-cigarettes, beliefs about nicotine, the chemical in general, to get a sense of how those interplay with tobacco harm perceptions and how those influence susceptibility to use and use of the products. So this is the basis for the current RO3 that I have on perceptions of nicotine and relative harm, with an incredible study team with collaborators from UVM, Rutgers, NYU, University of Nevada, Reno, and Schroeder Institute. And a sneak peek for you. So we have, from our Wave 10 data collection, which was completed in the winter of 2016, so just about a year ago, we have 4,091 participants aged 18 to 40 who completed the survey and provided data on these items. And what you can see here is over 50% of them believe that nicotine is a cause of cancer, with about 23% reporting they don't know. And there were a very small number of missing or refusals on these items. But you can see here that nicotine, we know, is not has not been shown to be the strong human carcinogen, but we see there's tremendous misperceptions about it in the population, especially in young people. And additionally, if we look at beliefs about, I'll wait. There we go. Thank you. Perceptions of the health risks of nicotine. So according to you, how large a part of the cancer caused by cigarette smoking comes from the nicotine itself? You can see that's the top two bars. So over 60% of young adults believing that nicotine is a large part of the cancer caused by smoking. And then on the bottom bars, according to you, how large a part of the health risks of smoking, so broadly health risks, come from the nicotine itself, and that's almost 66%. So almost 2/3 of young people believing that it is the nicotine that is causing the health risks of cigarette smoking. So this really, to me, highlights the need for public education on nicotine to complement and maximize the benefits of FDA's comprehensive plan. And I have some more information on a poster tomorrow about the correlates of those beliefs, and we'll be doing a lot more analyses using these data and looking at the correlations between the nicotine and tobacco harm perceptions. What we're seeing so far is that they're not strongly correlated. So it will be very interesting to disentangle that. So over this 5-year, 10-wave effort, we have had incredible impact, more than 30 publications, more than 40 presentations. We've used these data as pilot data for multiple grants and had a couple of grants funded to do analyses using these data specifically. But another really important outcome of this is that we had these papers cited, a number of these papers cited in the final deeming rule. So we know that FDA sees these papers. We know they're paying attention to this work and using this work to move forward regulatory policy, which is exciting. And we hope, as things move forward, maybe on menthol even in cigarettes, that we'll see more of these things coming forward. So this was a tremendous experience, a tremendous opportunity that I was involved in. it was really an unprecedented opportunity for policy research over a 5-year period. We really took advantage of the short window between the cycles to provide rapid turnaround, to provide research that was responsive and relevant to the questions that FDA was asking. And this was really made possible by having an adaptable collaborative team, by having a flexible survey platform where we could run experiments within the platform itself and randomize people, a motivation and a strategy to be informative. So we were always trying to think proactively about how we could use this tool to provide information, to inform our own work and also to inform policy questions that were existing. And also the generous support of Truth Initiative in funding the study, the generous support of NIH and FDA in funding grants that were related to this study, and really just the goodwill of everyone who was involved on the team in making this happen. So I see this as a potential model, and certainly how I'm thinking of the rapid response cores that are coming in the T-Course 2.0, and the opportunity to think proactively at the outset of these studies about setting up data collection mechanisms that are flexible enough to be able to pivot and collect data where FDA needs it, and partnering with FDA on those efforts. So again, I want to thank the incredible team. This is team science at its best. The core team, my partner in crime on this, Jessica Rath, all of our internal collaborators, our external collaborators. This was such a joy to work on. So thank you. I'm happy to answer any questions.
Hi, Darlene Brunzell, VCU. Thank you for a very nice talk. I was interested in the data you were looking at young individuals and their perceptions about nicotine. And my question for you is, what is the harm in young people thinking that nicotine is maybe more harmful than it is?
Well, I don't know that there's a harm in them thinking it's more harmful than it is, but I think what the beliefs that we're seeing here are false. So they're misinformed. And I think there is an important, especially as we're thinking about a comprehensive nicotine plan in which we're taking nicotine out of cigarettes, but it potentially remains in other products, there's a potential harm if people think that less nicotine in a cigarette means it's less harmful and they can keep smoking. So the balance here is providing information that informs people about the true harms of the product and being able providing enough information that they can make a decision that informs potentially their cessation, potentially preventing them from using in the first place, but if they're going to continue using, to inform them in a way that produces some sort of health benefit at the population level.
I think you gave a really good answer to that. I would add a commentary that we're not going to know for a few years just how harmful nicotine is by itself, or whether, like we see in preclinical models, nicotine can exacerbate cancer growth. And then there's the genetic studies that suggest nicotinic receptor subtypes, if you have the wrong genotype, can actually predict lung cancer. So I'm not so sure we should completely rule out nicotine as being dangerous. That may not be the right message, and only time will tell.
That's not what I'm saying. I'm not saying we shouldn't say that nicotine is harmful. I'm saying that nicotine is not a cause of cancer, and that's something we should correct. So I think there is appropriate information that we need to provide about addictiveness, about the impact of nicotine on initiation, on making it harder for people to quit, et cetera. But I also think that we do have data from NRT and other studies of nicotine itself. I understand that we don't fully know the harms of e-cigarettes, but we do know quite a bit about nicotine based on the existing literature.
Well, we can't divide the nicotine from all the other carcinogens in tobacco smoke. So the people who've taken nicotine replacement were smokers once before. And so I don't think it's just that conclusive yet that nicotine doesn't cause cancer. The preclinical studies, usually it's at the higher doses, not physiological doses. So yeah, there is some doubts there, but I would give pause to saying, absolutely not.
It's not described as a carcinogen in IARC reports, so we can look forward to more information and updating our evidence syntheses. Any other questions?
Hi, my name is Jamie Tam. I'm from the University of Michigan. And thank you for this talk and sharing this approach to being flexible with survey design in trying to be responsive to regulation as it comes out. Can you talk about how you balance some of the drawbacks of making changes to your survey over time? If you're adding things, are you taking things out? What might you have lost as you were trying to be flexible?
Yeah, that's a great question. So we certainly had items that came in and out, and we had items that we included for single waves that didn't come out. And so there were balances in determining what we could do moving forward. And it's really only when we've tried to do some longitudinal analyses moving forward where we've made small changes and sort of been frustrated with ourselves for the small tweaks. But in general, we had core items of the things that we thought were most important to capture, particularly the use variables that remained fairly constant up until, to be honest with you, up until the last wave, after we conducted the measurement experiment and we saw that the standalone items produced more reliable results related to prevalence. So we have, in waves 9 and 10, we have standalone items versus the select all that apply as in our earlier items. So I would say there are balances, but essentially we had a core set of measures that continued through the entire duration of the survey, and then things that came in and out based on what we thought was important at the time. Okay. All right, thank you.